No, I planned to see you. You were part of my post-operative Get Better Fast program.
Right.
Yeah. Right. So I had a full knee replacement, and I planned then to come to see you. As soon as I could after surgery. I tried for a long time, maybe a year and a half, 2 years, to sort of postpone. I didn't want to have knee surgery, so I tried to stay away from having knee surgery, and I went to physical therapy. And when I decided, people had said, I think it's often said, that you know when you need to have the replacement, and drugs weren't really helping, and the surgeon said he didn't think that the gel injection would work. So anyway, I decided to do the surgery, but I knew that exercising was critical to being able to get back to what I want to do. Basically, yoga and tennis.
Or what you normally do.
And swimming. You know, I had to be able to do those again. Well, I think I was pretty well informed because I had had terrible sciatica in 2009 that lasted for a year and a half because I didn't want spine surgery, and I exercised through that and did physical therapy through that. Then when my knee started to hurt, I did a lot of physical therapy. So I guess I had worked with, 4 physical therapists by the time, for various issues, by the time I decided to have surgery. I really loved the personal attention, and it just, so the physical therapy situations that I had been in were the sorts where a physical therapist was working with multiple units of us, right? Over a session. And so I got short bits of attention, but not concentrated attention over my hours worth of time, you know. So I got shifted off to handlers, basically. And the key physical therapist would come in and then tell someone else to take me and do other things. So I loved the one-on-one nature of treatment. That was really important. And the size of the studio here, the integration really of Pilates, which I'm very familiar with because I used to do it and would like to get back to doing it. I loved what I had learned about gyrotonics, and I want to do more of that because I've never really done that on a regular basis. So, I don't know, it just felt like this was pointed toward integration with my regular exercise life rather than being strictly medical treatment, which is what you feel, or what I feel, when I'm in a big physical therapy setting. Love the dogs too. Love the dogs. they're part of regular life too. So so I knew I would only be in town for a certain number of weeks. So you know, if I lived here and if I were staying here, I would just keep coming. Right. Because I think probably the physical therapy that my insurance will pay for is 3 months. So you know, I just would have worked in tandem with the insurance-supported physical therapy and this private physical therapy, or out-of-pocket physical therapy. I would have continued to do that here if I'd been able, but I will take this model.
Don't worry about it.
I will take this model and I'll use it in New Orleans and do the same thing there. I mean, everyone tells me I'm doing really well for 4 weeks after surgery, and you know, I credit you guys and also the surgeon's physical therapist is it's been teamwork, but
Mm-hmm.
I know I wouldn't have come this far this fast if I hadn't been here.